Hi everybody, my name is Mike Barrett. My firm, Barrett Benefits Group, is working for Classic Carrier on your health insurance program for 2012 and beyond. There was a lot of research into our solution and it was embraced by the leadership of Classic Carrier, and I'd like to walk you through it. I'm going to keep this presentation to hopefully about 7 minutes. So if you give me 7 minutes, I'll walk you through it. You have our contact information. We consider this just the start of the conversation. We have a team to support your needs as you go through the rest of this year, or 2012, sorry, we just started the year. What I'd like to do is give you the template of how this program works. In 2012, you will be remaining with Anthem Blue Cross and Blue Shield, so there's no need to worry about changing doctors and hospitals. We always know that that's the biggest concern that a lot of people have when they start a new health plan. We're remaining with Anthem Blue Cross and Blue Shield. Classic Carrier, however, has embraced our solution of shared funding. And what we do is we keep benefits, your benefit design, your out-of-pocket program, what it was before, but we're going to fund it differently. So what we've done with Anthem is we've purchased a high deductible health plan. All of the benefits are not going to be paid by Anthem unless you have $5,000 in claims. So it's a high deductible health plan that Classic Carrier is going to fund beneath that $5,000 to keep you even with what you had before. The only exception to that is wellness. Wellness is covered at 100% by your plan. So for men, women, and children, it's important to know that an annual exam is covered at 100%. Other than that, everything else is going to be managed by us. Shared funding program by Barrett Benefits Group. There are a lot of details to this plan, but I want to make it very simple on how you go out into the marketplace to consume your health care. There are 3 ways that we access health care: major medical, office visits, and prescription drugs. And I'm going to walk you through all 3 of those just to launch this so that you have an idea of what this program is about. The first are major medical claims. Major medical claims are inpatient hospitalization, outpatient surgery, or major testing. For those types of claims, although they're often the most expensive claims, those are the ones that you never pay for at the time of service because they have to be processed by the insurance company. So if you have an episode of care like that, you simply give your Anthem Blue Cross card, you get what you need done, the claim is processed by Anthem, we will obtain that claim, and we will process it according to your shared funding plan. The second way that we access care are office visits, urgent care, emergency room visits. Those episodes of care are going to be handled differently than in the past. In the past, you would pay your copay at the time of visit. Now, you do not pay anything at the time of the visit because you don't have a copay and that with Anthem. You have a high deductible plan. So what we recommend is when you have these episodes of care, you give your Anthem card, you pay nothing at the time of service, and you let the claim be processed by Anthem. We then will manage your shared funding by sending you a reimbursement check, and you will then use those monies to pay your provider, and the balance of that you will be responsible for your copay. So you will, if it's a specialist visit, it's a $50 charge. If it's a primary care visit, it's a $30 charge. You'll still be responsible for that, but you don't pay it at the time of service. You let us inform you of what your responsibility is on the end. So that's a little bit different, but you don't have to pay up front and then get reimbursed. By the time your bill is due, you'll be hearing from us. The third way that you access care is with prescription coverage. And with prescription coverage, there's no doubt that this solution is different. You have prescription coverage with Anthem. You have all the purchasing power and discounts that Anthem has with all of the members that have Anthem. So you have all that firepower. But it has to go to your high deductible, and then you're reimbursed back to what your copay is. So your copay is on that, the different slots of generic brand and non-preferred are on that handout. But there are 2 ways for you to access your prescriptions. One is You can go to the same pharmacies you're going to now, go and fill your prescription, and you give your Anthem card. The pharmacist will run it through the Anthem program, and then whatever that amount is that you owe, you'll have to pay for at the time of service. So if it's a $50 prescription, you're going to have to pay $50. You then can send us the receipt. If you'd like the quickest reimbursement, we will process it and send you your reimbursement check. So if it's a $10 generic, but the cost of the drug is $50, we'll send you a check for $40. We cut checks every 2 weeks, so you'll get that, if you send us the receipt, you'll get that check in that 2-week period. If you send us nothing, we'll have to wait till it's processed by Anthem. That will take maybe 2 or 3 weeks for us to grab that. You'll get your money back, but you're responsible for paying for it at the time you purchase your prescription. The reason for that is you don't have a copay plan with Anthem. Classic Carriers is stepping in to reimburse you. Now, for some of you that won't be a problem at all. You're either not on prescriptions or they're inexpensive, or you can put it on a credit card and perhaps you won't mind that phenomenon of paying up front and getting reimbursed. But we do understand that there may be some disruption to that there may be some challenges with either the cost of the prescription or just not wanting to pay up front and be reimbursed. So we've layered on top of this a value where if you're in Versailles, you can go to your local CAUP pharmacy, K-A-U-P. You have the information out to the Classic Carrier folks who work in that location. You can go into CAUP pharmacy. They will be aware of your program. You'll just pay your copay, and CAUP will bill us the difference. If you work outside of Versailles and you fill a prescription, if you work a way where you can't access CAUP, but yet you want to have a way of not having to pay your prescription because it's too disruptive, we will do everything we can to onboard a local independent pharmacy in your area. Just let Sharon know of the pharmacy that you would like us to contact. Locally owned pharmacies do a good job of working with us. The big box pharmacies typically don't because their systems are too massive to allow for this. But we want to make sure that everybody can get their prescription and that you get your money back fast, or if it's untenable, we want to set up an arrangement with a local pharmacy. So getting back to the solution for 2012, you're with Anthem. We're going to set up a reimbursement plan beneath this high deductible. You pay nothing if it's major medical. You pay nothing at the time. Pay nothing up front for major medical. You pay nothing up front for office visits, urgent care, or emergency room. But for prescription drugs, there are 2 ways that you can access your prescriptions. Either pay up front and we'll reimburse you, or take advantage of one of the local pharmacies. We do this for lots of groups. We understand that there are dimensions of this plan that change, but our goal is to keep your benefits where they were before and to be able to finance it this way. So you can rely on us to help you sort through this over the course of the year, and we'll make sure that the shared funding promise is kept to you so that your out-of-pocket is no different than what it was in the past. So thanks very much for giving me about 8 minutes of your time. Thanks.